Halo Sobat Ekon TV. Ada berbagai macam cara untuk mengobati penyakit artritis pada lutut. Di antaranya yaitu ada metode total knee replacement atau biasa disingkat TKR dan partial knee replacement atau UKA. Dibanding TKR, UKA ternyata memiliki sejumlah kelebihan seperti tingkat keberhasilan yang lebih tinggi dari 90%, pasien tidak terlalu merasakan sakit seperti saat operasi TKR, dan pasien tentunya lebih cepat sembuh. Maka dari itu, dokter spesialis tulang pada saat ini lebih merekomendasikan metode partial knee replacement untuk mengobati artritis. Simak penjelasan selanjutnya dari Dr. James Hao berikut ini. Sebelum lanjut menonton, yuk tekan tombol subscribe channel Tekon TV dan nyalakan lonceng notifikasinya biar kita tambah semangat untuk mengedukasimu.
When we talk about treatment, we first take a quick look at the injection option. Lubricant or gel injections are commonly given because they can be 70 or 80% successful in knee pain. The knee pain will probably not entirely go away, but it can become much less. And the effects can last for 6 to 12 months, in some patients longer. It's usually given as a single injection, so there's minimal pain and discomfort. And if the pain comes back again, you can always get a repeat injection, although it's worthwhile noting that repeat injections eventually become less effective as the arthritis becomes more severe. So we can view knee injections as a way of delaying knee replacement surgery, but eventually if the arthritis becomes severe, then knee replacement still becomes the main treatment option. Next slide, please. So for the longest time, total knee replacement has been the traditional operation for severe arthritis, and it has found 85 to 90% success rates worldwide. In addition, it's lasting, with more than 90% of total knee replacement lasting 15 years or longer, and it's a relatively safe operation with low complication rates. Next slide. However, in the recent past decade, partial knee replacement has become more popular, and the reason is because we use the latest minimally invasive surgery or MIS surgery techniques in doing partial knee replacement. So as you can see in the picture on the right, the partial knee replacement or UKA implant is much smaller than the TKR implant. If you look at the X-ray, you can see that on the right, the TKR implant is about 4 to 5 times bigger than the UKA implant on the left. So when you have a smaller implant, you need a smaller incision and you do less damage to the skin and soft tissue. This results in less pain after surgery with faster recovery of the TKR. Also, we find that the success rates are a bit higher with partial knee replacements, more than 90% success rate, which is a bit better than TKR. It's also a very safe operation, and data has shown that there are lower complication rates, so it's safer than TKR. In terms of how long it can last, more than 90% can last 15 years, which is similar to TKR, but it's important to note that you can only get lasting results when it's done by an experienced partial knee replacement surgeon. If the surgeon does not have experience in partial knee replacement, then it may not be as lasting. So we can say that UKA, when compared to total knee replacement, is safer, better, and gives patients faster recovery. So let's take a closer look at what we mean. When we say that it's safer than total knee replacement, we can look at data from many countries, including America, UK, and Europe. And if we're looking at data from the UK National Joint Registry, which involves tens of thousands of patients, we can see that because partial knee replacement is using minimally invasive surgery, there is less blood loss and you seldom need transfusions compared to total knee replacement. There's also a low risk of wound complications, and there's a much lower risk of infection. The UK data shows that there's only half the risk of infection when compared to TKR. And it's only 1/3 to half the risk of major complications when compared to TKR. So we can say that UKA is safer. Why do we say that it's better than TKR? Well, if we go back to what we discussed earlier, 75% of the native joint, where the bone, joint, and ligaments are healthy, all these are preserved in a partial knee replacement, Whereas in a total knee replacement, the entire joint is sacrificed, whether it's healthy or not, and more ligaments are sacrificed in a total knee replacement than in a partial knee replacement. As a result, because we preserve healthy bone and ligaments, patients normally feel that the knee is more natural feeling after a partial knee replacement. They don't think that it's a metallic knee or it's a robotic knee or it's an artificial knee. It feels like their own. In addition, there are studies that show that there's better knee flexibility after a partial knee replacement, and patients who have a UKA can, on average, bend 10 degrees more than a TKR. So this means that there are patients who do partial knee replacement surgery are better able to kneel and to squat, and that's important in our part of the world. Lastly, we'll say that it's faster in terms of recovery than TKR because partial knee replacement uses minimally invasive surgery. You can see the picture on the right. The scar from a partial knee replacement is much shorter, less than half the size and length of a total knee replacement. So there's less injury to the tissues and much less pain after operation. So most of our patients go home within 24 hours after partial knee replacement surgery. In addition, they have much quicker return to work. On average, they return to work 1 to 2 weeks earlier than total knee replacement, and a much more rapid return to sports, on average about 5 to 6 weeks earlier than total knee replacement. Okay, can we click? So this is a video. Can you click in the next? Okay, it's not coming out correctly. But basically, this is a 70-year-old lady who is about 3 hours after a partial knee replacement surgery. And you can see that she's walking very well with just a walking stick. The therapist on her left is just there to make sure that she's not falling, but she's not really helping her with anything. And she can walk for over 100 meters just 3 hours after surgery. Click next again. And you can see that the patient is able to raise her leg without any problem. And click next. And the patient is also able to bend the knee without any problem. So all this is within 3 hours after surgery. And this patient went on to go home the next morning. So we can see quite clearly that partial knee replacement, when compared to total knee, seems to be safer, better, and gives you much faster recovery. Next slide. So how do we get the best results after partial knee replacement? We talk about having the right patient and the right surgeon. So the right patient is someone who has knee pain that's isolated and it only affects the inner side of the knee. So we're looking at isolated inner-sided knee arthritis. And we know from the earlier slide that 90% of people first develop inner-sided arthritis in the beginning. And more than half of my patients are actually suitable for partial knee replacement. So it's important to see your knee surgeon early to get diagnosed early, and hopefully you can benefit from a partial knee replacement. So when we choose patients, we like to choose young patients, those who are working or who have active lifestyles, because they can go home early after the surgery within a day. They can also return to work very fast, usually within 1 to 2 weeks, and they can return to sports within 4 to 6 weeks. Older patients also can benefit from partial knee replacement, especially those who have existing medical conditions such as heart disease or stroke, because partial knee replacement is a safer operation than total knee replacement. It has a lower risk of complications, and so it's safer in this group of patients who are somewhat higher risk. Getting the best results after UKA also requires the right surgeon because partial knee replacement is technically demanding, and UKA surgery is actually more difficult than total knee replacement surgery. So we get the best results when we get a trained and experienced partial knee replacement surgeon doing the operation. And this is supported by studies and data. Again, we look at the UK data involving tens of thousands of patients, and we see that as the surgeon's experience or utilization rate of partial replacement increases, the failure rate drops. So when surgeons do only 5 to 10% of their patients as partial knee replacements, they get mediocre results with higher failure rate. But once more than 20% of their patients get partial knee replacements, they seem to get more excellent results. So in Singapore, I think most knee surgeons do UKAs for less than 5% of their patients. So to get more consistent and long-lasting results, it would be advisable to see a specialized partial knee replacement surgeon for the best outcome. Lastly, I'll explain what the Oxford UKA is and why I use it. So this Oxford partial knee design was first developed by Goodfellow and O'Connor in Oxford University. And this was in about 1980. And it has gone on to become the world's leading mobile bearing design for partial knee replacement because one, there is less implant wear with this design. It allows better knee flexibility for squatting and kneeling, and it results in a more natural feeling knee. After almost 40 years, it's the most clinically studied partial knee replacement design in the world. And despite being around for 40 years, it's been continually refined, and we're currently in the 4th generation design, which boasts very latest technology that enables minimally invasive surgery to be done precisely and accurately. It also has a special coating on the implant, which allows bone to grow into the implant to make it more secure. And this has been shown by data from Australia and UK to be more lasting than normal implants. Lastly, with 40 years of history, it has a proven track record. In fact, there is a formal training program by Oxford University Hospital that has to be completed before surgeons can use the Oxford partial knee system. And this ensures that surgeons who do this operation have a minimum level of experience and training. Lastly, because it has been around for so long, we know which patients do best with this operation, and we can select the best patients who benefit the most from this operation. Next slide, please. So in summary, mild to moderate knee arthritis can be treated effectively without surgery. Usually physiotherapy is the mainstay, and injections such as gel injections can be helpful as well. When the knee arthritis becomes severe, then knee replacement surgery is the go-to and is the gold standard currently. When we compare partial knee replacement versus total knee replacement, we can see that the evidence shows that it's safer with fewer complications, better in terms of outcomes with patients having more flexible and natural feeling knees, and it allows for faster recovery with less pain and early discharge home within a day, and also rapid return to work, usually within 2 weeks or less. Lastly, the Oxford partial knee is the world's most clinically proven system. And it's important to remember that you should see a specialized UKA surgeon for the best results, as surgeon experience has been proven by studies to be crucial for the outcomes. Thank you very much for your time and kind attention. I'll also end by saying that UKA is the safer, better, and faster option for knee arthritis nowadays.
Setelah menonton video ini, jangan lupa subscribe channel Tekon TV. Share video ini jika kamu mendapatkan manfaat darinya. Terima kasih.